If you're over 60 and someone recently told you your blood pressure is fine for your age, I want you to keep watching because that sentence might be one of the most outdated pieces of medical advice still floating around today. For decades, seniors were told that a little high was normal, even expected as we get older. But new guidance released just last year has quietly changed the target number doctors use for patients exactly like you. And here's the part almost nobody talks about. Aiming for that new number the wrong way can actually be dangerous for some older adults. So which is it? Should your blood pressure be lower than you think, or is chasing a number too aggressively putting you at risk of a fall, a dizzy spell, or worse? Stay with me. By the end of this video, you'll know exactly where you stand and what to bring up at your very next doctor's appointment. Older adults. I'm also going to walk you through two real patient stories that sit on opposite ends of this issue. One where normal for your age wasn't actually safe, and one where treating too aggressively caused a frightening fall. Both stories taught me something I think every family navigating aging needs to hear. Hi, I'm Dr. Alex Mandell. I've spent years sitting across from patients just like you, people who've worked hard, raised families, and just want to keep doing the things they love. Gardening, playing with grandkids, traveling, living independently in their own home. Blood pressure comes up in almost every single one of those conversations because it quietly affects all of it. This isn't going to be a video full of scary statistics or fear-mongering. My goal today is simple: to give you calm, clear, medically grounded information about what a healthy blood pressure actually looks like after 60. And just as importantly, when the textbook number doesn't apply to you. Before we go further, if you find this kind of health information helpful, hit that like button and subscribe. It genuinely helps other seniors and their families find these videos too. Okay, let's get into it. I want to start with a story because I think a lot of you will recognize yourself in it. For years, her blood pressure ran around 145/85. Her previous doctor had told her that was normal for her age and left it at that. Dorothy trusted that answer completely. Well, it's what a lot of us were taught in medical training too years ago. There used to be a widely used guideline that said adults over 60 could safely run blood pressure up to 150/90 without needing treatment as long as they didn't have other complicating conditions. But here's what Dorothy's family started noticing that she hadn't mentioned to anyone. She was getting more tired on her afternoon walks. Her memory for small things, where she'd put her keys, whether she'd taken her vitamins, seemed just a little foggier than it used to be. Her daughter chalked it up to normal aging. It wasn't until a routine visit almost a year later that we sat down and talked about what her numbers really meant and what had changed in the guidance since she'd first been told, that's fine for your age. Here's what almost nobody realizes, that 150/90 is fine after 60 guidance you may have heard is old. It's been replaced, and what replaced it might surprise you. Before we go further, let's make sure we're all speaking the same language because I find a lot of confusion starts right here. When you get your blood pressure taken, you're given two numbers. Doctors generally group those numbers into categories: normal, elevated, stage 1 hypertension, and stage 2 hypertension. Broadly speaking, normal is under about 120/80. Elevated is a systolic number in the high teens to 120s with a normal bottom number. Stage 1 generally falls in the 130s/80s to 89. Stage 2 is 140/90 or higher. Here's why this matters for you specifically. Where you fall in these categories, combined with your other health conditions and your overall cardiovascular risk, is what actually determines whether your doctor recommends lifestyle changes alone or lifestyle changes plus medication. It is never just about a single number in isolation. I know that's a lot of categories to keep track of. Here's the simple version. Lower is generally better for long-term heart, kidney, and brain health, but how low, how fast, and by what method needs to be personalized to you. Keep that phrase in mind because we're going to come back to it more than once in this video. MITH. A blood pressure of 140/80 or 90s is simply normal aging and nothing to worry about. Fact. Major medical organizations, including the American Heart Association and American College of Cardiology, updated their guidance in 2025. The current overarching target for most adults, including most older adults, is now below 130/80, not 150/90. This shift happened because large studies, including one called the SPRINT trial, showed that even adults in their 80s benefited from tighter blood pressure control with fewer strokes, less heart failure, and better protection for the brain over time. That's a big shift from what a lot of us were taught even 10 years ago. But, and this is important, the story doesn't end there, because for some seniors, chasing that lower number too aggressively can actually cause harm. I'll explain exactly who that applies to in just a few minutes. So keep watching. Let me explain this simply, because I know medical jargon can make this more confusing than it needs to be. Blood pressure is really just a measurement of how much force your blood is pushing against the walls of your arteries. The top number, called systolic pressure, reflects the force when your heart beats. The bottom number, diastolic pressure, reflects the pressure between beats when your heart is resting. For a long time, doctors believed that as arteries naturally stiffen with age, a somewhat higher pressure was the body's way of compensating, and that pushing the number down too hard in older adults might reduce blood flow to the brain and other organs. There's a phenomenon called white coat hypertension, where blood pressure runs higher in a clinical setting than it does in daily life, simply due to nerves. There's an opposite version too, called masked hypertension, where office readings look fine, but real-world numbers at home are actually elevated. This is exactly why home monitoring has become such an important tool. It captures what's really happening in your daily life, not just a single snapshot in an exam room. Newer research changed that thinking. Studies following thousands of older adults found that consistently elevated blood pressure, even at levels once considered acceptable for your age, was linked to a higher risk of stroke, heart failure, kidney decline, and something that worries a lot of my patients even more than a heart attack, an increased risk of cognitive decline and dementia over time. That connection between blood pressure and brain health is honestly one of the most important things I discuss with my senior patients, and one of the least talked about publicly. High blood pressure sustained over years can quietly damage the small blood vessels that feed the brain. For many families, protecting mom or dad's independence and memory is just as important as protecting their heart. Researchers have found that for every meaningful drop in systolic pressure, and the top number around across large groups of patients, there's a measurable reduction in strokes, heart failure, hospitalizations, and overall cardiovascular events. That's not a small effect. It's part of why so many medical organizations move together toward a lower, more unified target, instead of carving out a separate, looser rule just for age. So the updated guidance now recommends a target of under 130/80 for most adults as a general goal to work toward with your doctor. Notice I said work toward, because how you get there and whether that exact number is right for you individually is where this gets personal. His children had started noticing something was changing before he did. He was more forgetful during phone calls, sometimes losing his train of thought mid-sentence. His blood pressure had been running high for years, and no one had connected the dots. What happened next surprised his whole family. After several months of steady, careful blood pressure management, his daughter told me at a follow-up visit that he sounded like himself again on their weekly calls. I want to be honest with you, blood pressure isn't a cure-all for memory changes, and I can't promise every case improves this clearly, but it's a powerful reminder of just how connected these systems in the body really are. Here's where I want to slow down, because this is the single most important nuance in this entire video, and it's the part most seniors completely miss. That under 130/80 target is not a one-size-fits-all rule. Medical guidelines are very clear that for older adults who are frail, living with multiple chronic conditions, residing in a nursing facility, or dealing with a limited life expectancy, a less aggressive target may be safer and more appropriate. Why? Because pushing blood pressure down too far, too fast, in someone whose body doesn't tolerate it well, can cause its own set of problems. And this is exactly what happened with another patient of mine. Living alone, fiercely independent, still doing her own grocery shopping. After a hospital stay, a new doctor increased her blood pressure medication to hit that under 130 target as quickly as possible. Within 2 weeks, Margaret's daughter called my office worried. Margaret had fallen in her kitchen. Not seriously hurt, thankfully, but shaken. She described feeling lightheaded almost every time she stood up from a chair. Her blood pressure, sitting down, looked great right at the new target, but standing up, it dropped sharply. That drop is called orthostatic hypotension, and it's far more common in older adults, especially when blood pressure medication is increased quickly. It's one of the leading medical causes of falls in seniors, and falls, as many of you know, can change the entire trajectory of someone's independence. We adjusted Margaret's medication, slowed down the pace of change, and had her monitor her blood pressure both sitting and standing at home. Within a month, she was steady on her feet again, and still hit a healthy number, just not the most aggressive one and not on the fastest timeline. I share Margaret's story because I want you to hear this clearly. The goal is never just a number on a page. The goal is the right number reached safely for your specific body, your specific health history, and your specific daily life. If you're finding this helpful so far, this is a good moment to hit subscribe because I'll be covering more topics just like this, the kind of nuance your 10-minute doctor's visit doesn't always have time for. So how do you know if your blood pressure situation needs attention one way or the other? Here are signs worth mentioning to your doctor, whether you're worried about pressure that's too high or too low. Dizziness or lightheadedness, especially when standing up from sitting or lying down. Unusual fatigue that doesn't match your normal activity level. Headaches that are new, unusually severe, or different from your typical pattern vision changes. Even brief ones swelling in the ankles or legs. A noticeable increase in falls, stumbles, or near falls. New confusion or difficulty concentrating. None of these symptoms automatically mean something serious is happening, but they're worth writing down and bringing to your next appointment rather than dismissing as just getting older. I say this often to my patients. Your body doesn't usually announce a problem loudly all at once. It tends to whisper first through small changes like these, long before anything urgent happens. Learning to notice those whispers is one of the most powerful tools you have for staying independent longer. Let's get practical because I know a lot of you are watching this wondering, okay, Dr. Mandell, so what do I actually do with this information? 1. Get a home blood pressure monitor. The kind that wraps around your upper arm tends to be more accurate than wrist versions. Measuring at home at the same time each day gives your doctor a much clearer picture than a single reading in a rushed office visit. 2. Never adjust medication on your own. I say this gently but firmly. Never adjust or stop a blood pressure medication on your own, even if you're feeling fine, even if you read something online, even after watching this video. Medication changes, especially in older adults, need to be paced carefully, exactly like we did with Margaret. 3. Lifestyle still matters enormously at any age. This isn't about punishing yourself with a bland diet. It's about small, sustainable shifts, reducing added salt gradually rather than all at once, so your taste buds adjust. Reading labels on canned soups, deli meats, and packaged foods, since these are often hidden sodium sources many seniors don't expect. Moving your body most days in whatever way feels good and safe for your joints. Walking, swimming, gentle cycling, even gardening counts. Most guidance points to roughly 150 minutes of moderate activity spread across the week, which sounds like a lot until you break it down into about 20 to 30 minutes a day. And don't overlook simple balance and light strength exercises a couple of times a week. Not just for blood pressure, but because stronger legs and better balance directly reduce your risk of the kind of fall we talked about with Margaret. Always check with your doctor before starting something new, especially if you've been mostly sedentary. Limiting alcohol since it can raise blood pressure and interact with common medications. Managing weight gradually if your doctor recommends it without extreme or rapid dieting, which can itself be risky in older adults. And don't underestimate stress and sleep. Chronic stress and poor sleep quality are both linked to higher blood pressure readings over time. Something as simple as a consistent bedtime routine can genuinely help. If you or a loved one snores heavily or seems to stop breathing briefly during sleep, mention this to your doctor as well. Untreated sleep apnea is a commonly overlooked contributor to blood pressure that stays stubbornly high despite medication. Many of my patients ask me about a specific eating approach called the DASH pattern, which stands for Dietary Approaches to Stop Hypertension. In simple terms, it emphasizes vegetables, fruits, whole grains, low-fat dairy, and lean proteins, while going easier on red meat, sugary drinks, and processed snacks. You don't need to overhaul your kitchen overnight. Swapping one processed food for one fresh option each week is a realistic, sustainable pace for most people. One more practical note, especially for warmer months, older adults are more prone to dehydration, and dehydration can affect blood pressure readings in both directions depending on your medications. Staying consistently hydrated, especially if you're on a fluid pill, is a small habit that supports stable readings. On medications specifically, there are several categories your doctor might choose from, including ones that help your kidneys release excess fluid, ones that relax your blood vessels, and ones that slow your heart rate slightly to ease the workload on your heart. I won't go deep into each one here because the right choice depends entirely on your individual health picture, your other medications, and how your body responds. What I will say is that it's completely reasonable to ask your doctor why this particular medication and what side effects should I watch for. 4. Come prepared to appointments. Bring a written list of your symptoms and questions to your appointment. I promise you, as a doctor, patients who come in prepared get more out of a 15-minute visit than patients who try to remember everything on the spot. If this is resonating with you or with someone you're caring for, go ahead and share this video with them. Sometimes the person who most needs to hear this isn't watching. It's the adult child managing a parent's care. I want to pause here and speak directly to anyone watching who isn't the patient, but the son, daughter, or spouse managing someone else's care. This part is for you. A patient's son, his mother was 91 years old, living in an assisted living community, called my office frustrated. A well-meaning nurse had flagged his mother's blood pressure as too high based on the general under 130 guidance without accounting for her age, her frailty, or the fact that she was already on 3 other medications for unrelated conditions. He worried he was about to be pressured into a medication change that might not actually be right for her. This is such a common situation, and I want caregivers to feel empowered here. It is completely appropriate to ask a care team, given her overall health and quality of life, is this the safest target or the most aggressive one? Those are 2 different questions, and a good clinician will welcome you asking. For frail elderly parents or spouses, especially those in long-term care or dealing with a limited life expectancy, guidelines specifically allow for a more relaxed, individualized target. Comfort, stability, and fall prevention often outweigh chasing the lowest possible number. That's not settling for less. That's genuinely good medicine. The seniors who do best long-term aren't the ones with the perfect number. They're the ones who understand their own numbers, track them consistently, and have a real ongoing conversation with their doctor instead of a once-a-year data point. That habit alone changes outcomes more than almost anything else I see in my practice. I want to leave you with this reframe because I think it changes everything. Your blood pressure target shouldn't feel like a test you're failing. It should feel like a conversation you're having together with your doctor about what matters most to you. Your independence, your energy for your grandkids, your ability to keep living the way you want to live. Ask your doctor directly, given my age, my other health conditions, and my daily life, what target makes sense for me? That question alone puts you and your doctor on the same team, working from the same nuanced understanding I've walked you through today. I've found that patients who ask this question, rather than simply accepting whatever number appears on the screen, tend to feel far more confident and far less anxious about their care overall. Health isn't something that happens to you passively. It's something you actively participate in alongside people you trust. Before we wrap up, let me answer a few quick questions I get constantly in my office because I suspect some of you are wondering the same things right now. Can stress alone cause high blood pressure permanently? Short-term stress raises blood pressure temporarily, but it's chronic, ongoing stress sustained over months and years that's more strongly linked to lasting elevation. A single stressful afternoon isn't going to undo months of good management. Is it normal for blood pressure to be higher in the morning? Many people do run slightly higher readings in the early morning hours. This is a recognized pattern, but a consistent, unusually high morning reading is still worth discussing with your doctor rather than dismissing. Do I really need to check both arms? It's worth checking occasionally since a meaningful difference between arms can sometimes point to a circulation issue worth investigating further. My reading was high just once at the pharmacy. Should I panic? One elevated reading, especially in a public setting, is far less meaningful than a consistent pattern over several days at home. Try not to let a single number derail your whole day emotionally. Let's bring this all together. The overarching medical guidance has shifted toward a lower blood pressure target for most adults, including many seniors, because the evidence increasingly shows it protects the heart, the kidneys, and the brain over the long run. But that target is a starting point for a conversation, not a rigid rule, especially if you're managing multiple health conditions, dealing with frailty, or noticing symptoms like dizziness when you stand. The safest path forward almost always includes home monitoring, gradual medication changes made together with your doctor, and lifestyle habits that support your whole body, not just one number on a cuff. I think about Dorothy and Margaret often. 2 women, similar ages, similar independence, similar love for their families, and 2 very different lessons about blood pressure. Dorothy's story reminds us not to dismiss normal for your age without asking more questions. Margaret's story reminds us that moving too fast, even toward a good goal, has its own risks. If there's one thing I hope you take from this video, it's this: you deserve a blood pressure plan that's built around you. Not a generic number, not fear, just a steady, informed conversation with someone who knows your whole health picture. I know how much independence means to you. I see it every day in my patients. The desire to keep driving to your own appointments, keep hosting family dinners, keep chasing grandkids around the yard without worrying about a dizzy spell. Managing your blood pressure thoughtfully isn't about fear of what could go wrong. It's about protecting all of the things that make your daily life feel like your own. That's really what this whole conversation comes down to underneath all the numbers and the guidelines. It's not about a chart. It's about the years ahead and making sure you get to spend them feeling steady, clear-headed, and fully present for the people you love. If this video helped you feel more informed, please take a moment to like it, leave a comment letting me know what topic you'd like covered next, and subscribe so you don't miss future videos made specifically for adults navigating health and independence after 60. And if you know someone, a parent, a spouse, a friend who could use this information, please share it with them today. Before we close, I just want to say thank you for trusting me with a topic this personal. Take care of yourself, and I'll see you in the next video. One more reminder to like this video, drop a comment with your own experience or question, and subscribe if you haven't already. It really does help this channel reach more seniors and families who need clear, honest health information like this.